Hello, my name is Ashley Huffman, and today I will be demonstrating the technique of doing a thorough cardiac assessment. During my first semester of nursing school, I was required to demonstrate my knowledge of performing a cardiac assessment in front of my professors prior to doing this in the hospital setting on a real patient. Listening to heart sounds is a very vital part of a thorough nursing assessment. The cardiac assessment allows for the nurse to identify any significant factors that could influence the cardiovascular system, such as heart murmurs. Altogether, the assessment consists of a few different aspects, each of great importance, including the identification of the landmarks of auscultation, the general inspection, and the palpation of the carotid and temporal pulses. The first step of the cardiac assessment is identifying the landmarks of auscultation, or where to place the bell of your stethoscope to best hear the heart sounds. This is easily remembered by using the acronym APETM, or ape to man. As you can see, I have marked each of these points here with their letter, and I will go over what each letter stands for. The A stands for the aortic valve, which is located in the second intercostal space along the right sternal border, and it's right here. The P stands for the pulmonic valve, which is located in the second intercostal space as well, along the left sternal border, so it's across from the A. Next is the E, which stands for Erb's point, located in the third intercostal space along the left sternal border, and this is where you can hear the S1 and S2 heart sounds equally. S1 is the lub sound made when the tricuspid and mitral valves close, and S2 is the dub sound made when the aortic and pulmonic valves close, and E is right here below P. And as you can see, the letters kind of go in the same order as the ape to man or the APETM combination of letters. So the T stands for the tricuspid valve, which is located in the fourth intercostal space along the left sternal border. And it's right here below the P. Lastly, the M stands for the mitral valve, which is located in the fifth intercostal space along the mid-clavicular line, and this is also known as the point of maximal impulse, which is at the apex of the heart, or the bottom. Therefore, this is also where you would auscultate the apical pulse. And as I said, it is at the apex of the heart. The base of the heart is actually considered the top of the heart. The second step is the general inspection of the patient, which includes appearance, breathing, and color, the ABCs of the cardiac assessment. The patient should appear relaxed and at ease, with the skin color appropriate for their race, and unlabored breathing effort. If there is any blue discoloration to the skin or shortness of breath, this is a concern that needs to be reported to the doctor. The third and final step is palpating the temporal and carotid pulses, along with inspecting the jugular vein. The temporal pulse is felt lateral to the eyebrows on each side, and the carotid pulse is felt along the sternocleidomastoid muscle in your neck on each side. However, the carotid pulse should be palpated one at a time, as they are what supply the head or your brain with blood, and it's right here in your neck. You should be noting any non-symmetrical or low amplitude pulse pressures, and you also want to feel for any thrill which could indicate turbulent blood flow or an obstruction. By inspecting the jugular vein and its angle, the nurse can determine if any blood is backing up into the jugular vein from the right atrium of the heart, which would be indicative of right-sided heart failure. And this is done on the right side of the neck, and it's, along here, and you have to use a ruler to try to kind of measure that angle and see if it's correct and make sure there's no pulsating vein. You want to see the vein, but you don't want it to be pulsating. So in conclusion, this is a very important technique used to detect any issues early. By identifying the landmarks, assessing the patient's appearance, and palpating the pulses, the nurse should be able to detect any issues in a timely manner. Every nurse needs to know and practice the correct technique in order to recognize illness quickly and treat it. Thank you.